Everybody, it's Becky Pearson with Pearson Physical Therapy, and today I am joined with Sheila Kennedy from the Area Agency on Aging. Hey Sheila, how are you?
I'm good, Becky. How are you doing?
Good, good. Why don't you tell us a little bit about yourself and a little bit about what the Area Agency on Aging is?
Okay, so my name is Sheila Kennedy, and I am the SHIP regional representative. So SHIP stands for State Health Insurance Assistance Program. So we do Medicare counseling is basically what we do. So we help people sign. Well, we don't actually sign people up for Medicare, but we show them how to do that. That's actually done with Social Security. We do Part D comparisons every year during open enrollment. We do a lot of troubleshooting, helping people get information about supplement plans, drug plans, just how to navigate getting in and through the Medicare process, basically.
It can be really confusing for people, and so I think it's great for people to know that they can call your office and get some advice on that. I remember one family member that went on when she went on Medicare. They didn't have the Part D necessarily, and she wasn't taking any medicine when they did roll it out, so she didn't sign up for Part D, but and then later had some heart issues, and she didn't realize she was going to have to pay a penalty, right? Because she didn't sign up for
Right,
it.
right. That happens. And it happens a lot. So yeah, people that don't take meds don't realize that if they don't get a plan right away, once they do get one, then there will be a penalty for the time that they could have had one but didn't get one.
Oh wow.
So uh, that happens a fair amount. So we try to make sure that people know that. And the penalty is not big, it's only like 36 cents a month. But if you let that go 2, 3, 4 years, then they, add that up and they tack that on to your premium once you do get a plan for the rest of your life.
Wow.
So it can add up fast.
Yeah, yeah. So getting some good advice when you're signing up, that would be helpful. Um, so we're seeing a lot of ads on TV, and we see it here in the PT clinic. There's a lot of talk about these Medicare Advantage plans, and that's the biggest reason why we wanted to reach out to you was understanding the differences between. I think people don't necessarily understand maybe what Medicare Part A is and Medicare Part B, and then a Medicare supplement. And then also now we throw in the mix this Medicare Advantage plan. Can you dive into sorting some of that stuff out?
Yeah, so let me just kind of start from the beginning. I'm kind of a hands talker, so you see my hands flailing, that goes. So parts A and B Medicare are your original Medicare through the federal government. So that's the red, white, and blue card that you get when you initially sign up. So whether that's at age 65 or when you retire, however that works for you. So A and B are your original Medicare. A pays for anything that's related to inpatient hospital stays. Part B is the medical side, so it's going to pay for things that like doctor's office visits, outpatient surgery, durable medical equipment, those kinds of things. So they kind of work together. Those are from the federal government. So there are generally it's not a premium for Part A because that's the what you're paying into when you work. So as long as you've worked at least 10 years in your life, you've generally paid that, so you don't have a premium for Part A. Part B does have a premium. Right now, it's $144.60 a month, and that can change every year just depending on what the federal government does, whatever they decide to do. So we don't always know. Sometimes it stays the same, sometimes it changes. Just depends. But right now, it's $144.60. So that's your original Medicare. So generally, you have two options from there. We usually call option one would be getting a supplement plan or a Medigap plan, you'll hear it called. Those are designed to come in and supplement what your Medicare Parts A and B don't pay. So it's going to pay the deductibles. It's going to pay the other 20% because the Parts A and B pay 80. So it would come in and pay the other 20%. The drug plans then come in and pay for the prescription medication. So those are another thing, another card, so to speak. So in that scenario, you would have your original Medicare card, the red, white, and blue one, a supplement card, and then a drug plan card. So you'd have 3 different cards. So then that's kind of the first option. That's probably the option that most people in this part of the state have if they've been on Medicare for a while. The Advantage plans or Part C of Medicare are fairly new, honestly. I've been doing this 7 years, and we've had 1 Advantage plan available in our region up to now, and now we have like 16. So it's gone, just crazy. But so it's new. It's a new concept for people out here in this part of the state. It's new for us to work with, meaning that I just don't have a lot of a lot of experience with these companies as far as the Advantage plans go. But that would be an option to the first scenario I was talking about. So you would either do your original Medicare with a supplement and a drug plan, or you would do Part C Medicare, which is an Advantage plan. With the Advantage plans, you will still have your Parts A and B. So you keep that original Medicare, and you will still pay the Part B premium. So that $144.60, you are still paying. What happens then is that goes to the Advantage plan company, whoever it is that you're working with, as part of the premium. And then you pay another premium on top of that. Some of the plans that are available right now don't have any premiums. Some have, fairly high premiums, but pay very well on the services. I mean, there's a whole gamut of different companies and options with those. If you ever see Joe Namath on TV, that's what he's talking about when he's talking about, vision, dental, hearing, free meals, rides to doctor's offices, those kinds of things. Advantage plans do offer those. Not all of them offer everything. So the main thing to keep in mind is, you really need to look at the fine print on those Advantage plans, because it's not all about premium. That really catches people once in a while. If you are someone who has had Medicare for a while and you have a supplement plan or have had a supplement plan and are used to paying nothing when you go to the doctor, because supplement plans are kind of designed as a pay up front option. So you're going to pay a little higher premium up front, but then probably not pay a lot after that. Won't pay, co-pays at the doctor and those kinds of things. With a Advantage plan, it's more of a pay-as-you-go option. So what happens is you're paying a lower premium or whatever up front, but then you're still paying co-pays every time you go to the doctor. If you have, outpatient surgery, you might pay a percentage of that. So there are costs that are incurred throughout the year. So that's kind of the difference. If you have, a very healthy year, the Advantage plan would probably be a cheaper option. We can't predict that necessarily. You could be a very healthy person and take very good care of yourself, but get in a car accident and still have, significant health costs. So it just kind of depends on, your choices.
So I think that's a good point, and that's a point that I didn't necessarily realize either. What we've been seeing here in the clinic is that somebody comes in and they have a United Healthcare Medicare Advantage plan or a Medica Medicare Advantage plan, and we as a clinic are in network with United Healthcare and Medica, but we're not considered in network for these Advantage plans. So then it gets very, very confusing, not only for us as the provider, but then for the patient as well. So, I think sometimes they're sold to people as this is a more reasonable or economical solution to higher premiums for those secondary plans or the Medigap plans. But yeah, really, I think diving into what do they pay? Do you have to pay copays at your visits? And do you have to figure out that you're going to have to pay along? Because some, as we know from so many things, oftentimes if it looks cheaper, it's usually cheaper for a reason. And so you're going to have to pay for it maybe one way or the other. And I think if you have providers that if you have a doctor that you really like, you have a physical therapist that you really like, if you are thinking about switching, I think it would be beneficial for people to call those providers and say, hey, are you in network with such and such Medicare Advantage plan? Because, we have people that really do end up, coming, they know, like, and trust us. So they come often for, whether it's back pain or hip pain or, when they have aches and pains, we are one of the first calls that they make. And so if we're not in network with this new insurance that they're in, then it really throws a big monkey wrench into things for sure.
It does. And I think that's been, since now this year has started, I think that's been the biggest thing. People have gone, oh, when I talk to people about Advantage plans, that's one of the first things I say is, I want you to go do your homework and call your providers and make sure they work with whatever plan you're considering, because that's a big deal. And with the supplement plans, you don't deal with that. If the provider accepts Medicare, then they'll accept the supplement plan. But that's not the way it is with the Advantage plan. So that's one thing that I really make sure people understand. So a couple of the other things that I think are important to know is that, is with a supplement, you apply or you get it one time, you have it, and generally you will keep it. You don't have to review it every year. You can if you want to, but with the supplements, there's a one-time 6-month guarantee issue window to get one of those. So generally when you retire or when you're 65, you have that guarantee issue period to get one, and then you pretty much stick with it. If you decide at some point, you think it's getting too expensive or whatever, you can switch those supplements, but at that point you would have to go through underwriting. So if you have any kind of health issue that has occurred between when you got it and now, that may affect whether they accept you or not. So it's kind of a one-time enrollment. With the Advantage plans, you do have a yearly opportunity to review those. They are not guaranteed renewable like the supplements are. So potentially, you could get into one, and then the next year the company decides not to offer that plan anymore. So you'd have to switch, which really isn't that big of a deal. So it's more like a drug plan, you can switch those every year. But for some people, it's just, that's too much. You finally kind of get used to what's going on and how it pays, and then you find out that it's going away or whatever, and then you have to kind of change your mindset, and that can be challenging sometimes, just to keep up with that. But I think, as long as you it's hard out here because we're just so used to the supplement plans. It kind of just takes a mind shift. But as long as you kind of know what you're talking about and you have someone helping you that's going to tell you all of the details and all of the consequences, potentially of getting that plan, it can be a good option for people.
Yeah. So if they get into a Medicare Advantage plan and they don't necessarily like it once they're into it, is there a way for them to get out of it, or do they have to wait like until open enrollment or things like that?
No, if you are trying a Advantage plan for the first time, so whether you have had a supplement before and now want to try an Advantage plan, or you're just new to Medicare and you're trying, starting out trying an Advantage plan, you have a 1 year trial right with those plans, as long as it's the first time you've tried one. So you have 1 year to try it. And then if you, within that year, don't like it and want to go back to your supplement or decide that you would rather have the supplement portion, then if you had the supplement before, they have to take you back. So you can get back into the supplement that you had before. Otherwise, you can get into a supplement if you're just starting out too, if that's what you want to do. So you do have that trial right, which is good, but a lot of times you're not told that. So it's important to know that, because if you're someone that does utilize healthcare a lot, if you are going to the doctor frequently, your out of pocket with an Advantage plan is going to feel higher, and could be potentially, because you are going to pay something every time you go. So it's just important to know those things.
Yeah, I think that's very good. These are a lot of questions that I have no idea what the answers are. So I'm learning a ton here too. So
I know one thing too, with people who are just coming, aging into Medicare and just starting, the eastern part of Nebraska has had Advantage plans forever. That's not a new concept out there. So, I mean, there are a lot of people that have them. And so people who are coming out of coverage from an employer, the Advantage plan is going to look more like that. They're designed more like what you have with an employer. That is just when you come down to provider networks and those kinds of things, you really got to pay attention. Does it cover your meds? That's another thing. It may have a zero premium, but maybe the med coverage doesn't cover everything that you take. So your zero premium doesn't mean anything if you have to pay full price for medication. And if you're on insulin or some of the newer medications, that could be extremely expensive. So that is something that I always make sure people understand too, when they go into any plan, no matter what it is, if it's just a standalone drug plan or an Advantage plan, you really got to pay attention to the medication. Make sure that it covers all your meds. And I think that's why, mainly why there is an open enrollment option every year, because the standalone drug plans and the Advantage plans, something about them is going to change every year, whether it be the premium, coverage, formularies, those kinds of things. So it's going to change. So that's why they want people to review them. That's why they want you to review them every year. Because if your plan might cover your meds this year, but may not next year. So you need to keep on top of that if you can. Okay. And we do that for people. So.
Okay. So if somebody has more questions about this or would like more guidance on this, where can they get a hold of you, and what would their next step be?
Okay, yep, they can call me at the Agency on Aging in Kearney. I'm working from home now, so the process is a little, you call, leave me a message, I'll check my messages and call you back. But I'm pretty good about within 24 hours, you'll hear from me for sure. Usually not even that long, but so the Agency on Aging phone number is 308-234-1851, or you can call the SHIP 800 number, which is 1-800-234-7119. And when you call that 800 number, it's going to ask you, what office do you want? It's going to list them, and you just say Kearney, and then it'll get you here. But yeah, so anything, sometimes when people work past age 65, that it moves them out of that initial enrollment period. So if they're retiring later, there's a lot of questions, you know, and everybody's situation is different. Employers handle things differently. Maybe you have a spouse who's not 65 yet and still needs insurance, but you want to go on Medicare and you carry that usually. I mean, you know, so there's a lot of different scenarios, and we'll just help talk people through that so they know what to do.
Now, do you guys also help people with applying for disability, Social Security, Medicaid?
No, nope, we don't. Social Security, disability, and well, those two would have to be done with Social Security. And then Medicaid is with Health and Human Services. We do have, with the Agency on Aging, we have programs that, you know, if it's someone who's in need of help, really can't do it themselves, we have programs that have assistance with that. We do Medicaid waiver, we have case management, that kind of stuff. So there might be an option for those other things, but me and my program, we kind of just stick with Medicare. We used to kind of help people sign up for Medicare, but the online process has changed with Social Security. So we've had to just hand it back to Social Security just because of some of the things they're requiring now. So.
Okay. All right. Well, thank you so much, Sheila. It was very educational, and we will try to link some of the graphics that you've sent to our office when we post this. So if people have more questions, hopefully it'll get some education out there and stimulate some questions and get some answers for them. So
all right, that sounds great.
All right, great.
Thanks
you have
a
a wonderful day.